Is pain while chewing really just an age issue? Most of the patients over 60 years walk into my clinic with the complaint, डॉक्टर अब चबाने में थोड़ा दर्द होता है, एज हो गई है ना. And this belief, pain while chewing is a part of aging, is a biggest myth that I want to break today. Chewing is just not about teeth. It's about digestion. It's about nutrition. It's about facial balance. And most important, it's about independence and quality of life. If chewing becomes difficult after 16, it's not aging. It's just a signal like any other signal in the body which needs attention, not acceptance. Over 70% of adults above 60 experience difficulty in chewing, but less than 30% seek treatment. In this video, I will explain how chewing becomes painful after 60 and what is happening inside the mouth and how the modern dentistry can restore the function with predictable result and comfort with safety. What chewing actually involves, most people don't know this. Chewing is just not the function of teeth touching the food. It's actually more than that. It is one of the most complex procedure that our body performs. Chewing activate more than 30 muscles at a time and both jaw joints work simultaneously. Chewing involves teeth, gums, jaw bones, jaw joints like TMJ, nerves, saliva, muscles of mastication, and all these factors will contribute to the digestion. When one element weakens, the entire system suffers. After 60, multiple systems start getting compromised, not because of age alone, because of years of neglect, untreated issues, and fear for any kind of treatment. Pain while chewing is rarely sudden, but it's the final stage of long silent deterioration. Tooth loss and bite pressure. One of the most common reasons for painful chewing is missing teeth. When a tooth is lost, the chewing load shifts to another teeth. Bite become uneven. Teeth now has to work harder. Muscle strain and jaw joint get stressed. Over the time, this lead to pain while biting, tender gums, tooth mobility, jaw pain, headache. Many seniors say, I just lost one or two teeth. What difference does it make? It makes a huge difference. Losing just one molar increases the bite pressure on other teeth by 30%. Your mouth works as a unit, and if you just remove one part, the entire system collapses gradually. Another silent culprit is gum disease. After the age of 50 or 60, gums recede, bone density decreases, and teeth lose their support. And this causes pain while chewing, bleeding gums, burning sensation, and mobility of the teeth. What's dangerous about the gum disease? It's often painless in the early stage. Patient can only address it when chewing becomes painful. By the time pain appears, bone loss has already begun. And bone loss just doesn't affect teeth, it affects facial structure, nutrition, posture, and overall well being. As we age, teeth naturally wear down, but excessive wear is not normal. It happens mostly because of years of grinding, acid reflux, and poor restoration that can lead to enamel thinning. Enamel is a protective covering on the tooth, and when it wears, sensitivity occurs, and chewing or pressure become painful, and cracks develop, and slowly you feel pain on biting or chewing. This pain is often described as डॉक्टर कुछ हार्ड खाया तो झटका लगता है. That झटका is actually a cry for help from the tooth. Many seniors still rely on old dentures, ill-fitting restoration, quack processes, and outdated crowns. These causes gum soreness, pressure points, ulcers, and jaw fatigue, and most important, pain while chewing. When the bite collapses, face follows. And pain on chewing, not mostly because of teeth. After 60, the jaw joints lose cushioning. Weakness because of nutrition and muscular atrophy may be the signs of aging which contribute to such other factors. This leads to clicking sound, pain near the ear, difficulty in mouth opening, and fatigue while eating. Patient thinks it's arthritis or normal stiffness. It's actually collapsed bite which modern dentistry only can correct. When chewing hurts, seniors unconsciously avoid hard food, shift to soft carb heavy diet, and completely stop eating fruit, nuts, and protein. This leads to poor nutrition, weak immunity, digestive issues, memory impairment, and muscle loss. Emotionally, they stop eating socially, avoid family functions, and away from all the conversations. Poor chewing ability is directly linked to poor nutrition, memory decline, and lower life expectancy in seniors. Painful chewing doesn't just hurt the mouth, it shrinks the life. Why seniors delay treatment and why it's dangerous? Few of the most common excuses are डर लगता है, बहुत महंगा होगा, अब करवा के क्या फ़ायदा, अब मैं जी ही कितना लूँगा. But the truth is, delaying treatment after 60 leads to faster deterioration. What could be a simple correction today becomes complex surgery tomorrow, higher cost over time, and more discomfort later. Modern dentistry today is safer, faster, more predictable, and more comfortable. How modern dentistry restores comfortable chewing? Tools like CBCT for precision, implants for load sharing, full mouth rehabilitation for bite correction, and conscious sedation for the anxiety free care. This is how we all take care of your worries. We can restore proper chewing balance, comfort, confidence, and a pain free chewing. Chewing should feel comfortable and natural again, not tiring, not painful. Pain is a signal, not a sentence. If chewing has become difficult after 60, so it's not because of aging, it is just asking for attention. You deserve comfort, nutrition, confidence, and dignity at any age. Your smile doesn't retire, so your quality of life shouldn't either. As I always say, dentistry is not expensive, neglect is. Thank you.